If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to the latest episode of Outbreak News Interviews. And I want to start out by reading a paragraph from an introduction to a book we're going to discuss a little bit today. And it goes like this. This spreading toll of tick-borne disease is not a random act of nature. By virtue of the developed world's lifestyle and influence, the cars, the suburban tracks and carved-up forests, the diminished biodiversity, the emissions and airplanes, we have paved the way for the first global epidemic abetted by climate change. Warming may not have caused this scourge, but it certainly is enabling it. And that's from the introduction to a fairly new book entitled Lyme, the First Epidemic of Climate Change. And we are going to talk to the author, Mary Beth Pfeiffer. Hi, Mary Beth, and welcome to the program.
Thank you, Robert, for having me.
You bet. Well, let's go ahead and start out with a short summary of the book and why you wrote it.
Well, I'm an investigative reporter, and I live in an area of the world that has among the highest rates of Lyme disease, that being the Hudson Valley of New York. Mm-hmm. That's not to say, though, that Lyme disease isn't equally problematic in many areas of the world, and we'll get to that. Sure. But I knew about Lyme disease. I knew it was a problem in my community, but it really wasn't until I began to investigate it about 6 years ago that I learned how serious a problem it is, how many other pathogens beyond the Lyme pathogen live inside the guts of ticks, what damage they're doing, what difficulty people have getting care for those very new illnesses, and especially when they are combined in one bite. And beyond that, the ways in which this epidemic is spreading around the world, the environmental factors. So I combined the environmental factors with the health factors, and this is the result, the first epidemic of climate change.
Okay. Now, as the title of the book says, the issue of the effect of climate change on Lyme disease is the major theme. Mary Beth, can you give the listening audience some factual data based on your research for the book that specifically points to climate change's effect on the tick-borne illness?
Well, it's pretty well established in the scientific literature that there is a clear correlation, a parallel between the movement of ticks and the warming of the planet. So, for example, we have archival data, some of it from the Alps in Bosnia, for one example, in which in the late 1950s an industrious scientist climbed the mountain and looked how far up the mountain ticks could survive. 40 years later or so, we have another scientist going back, and sure enough, this scientist finds that whereas the ticks could only survive at 800 meters, they're now at 1,200 meters. We have other data like that showing what is called altitudinal expansion. In other words, they're going up mountains. But that is in itself an example of what's happening on latitudes. We see them going up the Scandinavian peninsula, for example. We see them moving now into Canada,
Right.
just as they moved northward into the Northeast and the Midwest, and have expanded in many areas around the globe. They're moving northward in the northern hemisphere. They're moving south in the southern hemisphere.
Now, you also write quite a bit about Lyme medical policy, public policy, and I want to get your thoughts on, is the medical and public policy about Lyme disease a detriment in your view? And what are the issues that you see that are good and bad?
Well, Lyme policy, as it relates to diagnosis and treatment of Lyme disease, is vastly outdated. It has failed to progress over the last 20 years or so and more or less remains stuck in the same place. And a large part of that is the great influence of the people who believe in the reliability of the Lyme disease test to tell whether you are or are not infected with Lyme disease. These players have great influence. They are in the Infectious Diseases Society of America. They authored the guidelines. They have published in the New England Journal of Medicine. Their science has been embraced by the U.S. Centers for Disease Control. But what I found in my reporting is that while that was an accurate and adequate view of Lyme disease 20 years ago, there's been a lot of other science that has come along to challenge it. And that science is slowly breaking through. And it's finding, for example, that 10 to 28 days of doxycycline, which is generally administered if you have Lyme disease early on, may not, in fact, work in many cases. They are finding that the Lyme bug survives in monkeys, it survives in mice, it survives in test tubes. So this is questioning that Lyme paradigm. Further, we have found many studies over the years that have questioned whether we are using the correct diagnostic for Lyme disease. All of this is under review, is open to question, and it is being questioned at the highest levels of our government. There's now a tick-borne working group that is revisiting how we manage Lyme disease in America. That's very overdue, and it's a really good development.
Okay, let's talk about something a little more personal. You include a number of individual stories in your book. Any one of those that really touch you the most, or do you have a favorite chapter?
Well, there are many stories that I hear about Lyme disease that are touching, are tragic, are disturbing. I think probably my favorite chapter is the chapter on children. Children 5 to 14 years old are the group of people who are most frequently infected. Our children need to be protected against ticks. And I talk about a boy named Troy who had a case of Lyme disease when he was about 10. And shortly after, several weeks after, became very ill. He came down with what appeared to be the flu. It got progressively worse. Couldn't get out of bed, lost a lot of weight, was hospitalized. And after 8 days in the hospital, this shriveled boy who could no longer walk, who was very angry at his situation and really regressing mentally and physically, was diagnosed by doctors with something called pain amplification syndrome. They basically concluded that his symptoms were psychological in nature. So he was released from the hospital with antidepressant medications and other instructions about breathing techniques and so forth. Well, an outside doctor ultimately diagnosed him with Lyme disease as well as several other tick-borne diseases. I saw his medical records. There was a lot of evidence that he had these pathogens in his bloodstream. But when he was in the hospital, the doctors there did not look for any evidence of tick-borne infection. And this happens very frequently, that doctors don't want to consider Lyme disease. They don't want to consider, in particular, the other bugs that are inside of ticks because they do not know how. They have not been given the tools and the information how to treat these organisms. And I would just add that story occurred in the state of Connecticut, which is where Lyme disease was discovered 40 years ago. This was just 2 years ago in a major hospital that this story unfolded.
Now I'm going to ask you to look into your crystal ball. You did all this research on Lyme disease and the climate change and the public policy. And Mary Beth, where do you see these two main issues, the climate change and the public policy, in 5, 10, 15, 20 years? And for the second part, as far as the public policy, do you see these two divergent groups, the advocates and the establishment, coming together on this?
Well, I do see on the health side the advocates for Lyme disease sufferers and the policymakers coming together. I see that happening in this working group that is meeting in Washington, D.C., that is revisiting everything we believe to be true about Lyme disease and opening it up to question. As far as climate change, we have a very long way to go before we make the changes, the very basic changes in our social structure, in our commercial structure, in our industrial structure, to change what needs to be changed to bring that under control. I mean, even the way we create waste in America is way beyond the pale in terms of what is necessary, and changes need to be made in how that happens. You know, the way we use energy. We've made some strides in terms of solar power, in terms of wind power, but politically, we are still in a very bad place in terms of grappling with climate change and its very, very grave implications. You know, my book is not about climate change itself. It's about one outcome of climate change.
Right.
There are so many more out there, and we need to tackle them. And I'm looking to tackle tick-borne disease and ticks in the environment. But beyond that, we have a lot of other work to do on climate change.
Okay, now I just want to kind of give you the floor, and if there's anything you'd like to talk about concerning the book, your research, or whatever, go ahead, Mary Beth.
Well, I when I wrote my initial articles on Lyme disease, I very much found myself outside the mainstream of journalism, as well as the mainstream of medical belief and dogma. And, you know, it's the job of journalists to question authority and to question prevailing views, especially when evidence suggests they may be wrong. So I'm rather in a position today, even 6 years after I began that research, having produced a book that is based firmly on science, that has a lot of personal stories behind it, that has a lot of scientific evidence and interviews with scientists and interviews with physicians who know what they're doing, who are trying to challenge this prevailing view of Lyme disease. And I, as well as them, have had difficulty breaking through, have had difficulty getting the powers to be to accept the fact that we need changes. So, you know, I can appreciate people like Bill McKibben who is challenging belief on climate change and who's trying to break through, who's trying to change a very hardened landscape of energy usage and so on and so forth that have created this dynamic. Well, I'm in a much the same position, challenging existing dogma, pushing hard against it, and frankly appreciating, Robert, what you're doing and giving me a platform to do that.
Mary Beth, any plans for a follow-up to this book?
Well, there are plans to, research what is going on now in terms of diagnostics, for example, on Lyme disease. There are tests in development. There are vaccines in development. Are they good? Are they not good? They raise a lot of questions to me. So I'm continuing to monitor the major issues of Lyme disease and tick-borne disease. And to follow them, I think it's really important to follow this through. You know, this disease has changed the way we view nature. And that is a huge tragedy as a result of the spread of ticks. I live in the country, and across the lane from my home is a 7-acre old cornfield that has overgrown and has beautiful wildflowers in it. And with the cooperation of a neighbor, we mow a path around this lovely field. And I walk that field with my dog and with my grandkids sometimes. And I'm constantly saying to the kids, stay away from the tall grasses at the edge of the field. Make sure you are careful not to get ticks on you. Have mommy check you when we get back in. You know, that sort of thing. I'm inculcating them with the idea that nature is to be feared as well as to be enjoyed and loved. But I want to take that fear away.
Okay. Now, if somebody wants to check out your book, Amazon.com, I'm sure. Do you have a website or something they could check out?
I have a website with my reviews, which have been very good, and it's called thefirstepidemic.com.
Okay, perfect. So you can check that out, thefirstepidemic.com. And again, the name of the book is Lyme, The First Epidemic of Climate Change, and the author is Mary Beth Pfeiffer. Mary Beth, thanks for joining me today to discuss your book.
Thank you so much, Robert. I appreciate it.
You bet.